I'm Dr. Craig Popp. I'm an orthopedic spine surgeon at Vero Orthopaedics and Vero Neurology. I've been practicing in the state of Florida for the last 2.5 years and previously was in a practice for 20 years prior to coming out here, and my primary interest is in degenerative conditions of the spine. It's quite interesting. The weight has a huge part on the load on the spine, especially in standing, sitting, any type of activity you do. And if you can actually lower your weight and have a better BMI, there is a strong possibility some of the back symptoms you have may improve. The other thing that's important is when you do surgery, that if you have a lower BMI, you're more likely to have a better outcome. It is common that when I'm doing a case like this, there's a lot of excess adipose tissue in the back, and that is an extra layer of tissue that I have to go through, and it is a nidus for infection. It's a nidus for increased drainage following a procedure. It does lead to more complications. It also makes the surgery more difficult because visualization becomes more difficult in the sense that you're, instead of working through a space this deep, you're working through a space this deep, and that excess fat tends to flow into the field, so you have to use special kind of retractors that puts more pressure on the tissues and can cause more problems. The way things occur in medicine these days is if you have a procedure you're doing on someone and there's a complication, what happens is the hospital ends up eating the cost of a readmission. And if you have proven data showing that, let's say if you do a total knee or a total hip or a spine operation that shows that a person with an elevated BMI is more likely to get an infection, the insurance companies are less likely to approve that procedure. But the other thing is also insurance companies are aware of the fact that if they get readmitted, it's going to cost them more. And Medicare especially doesn't cover readmission costs. You know, within a certain period of time, if you have a complication, if you're readmitted to the hospital has to eat the cost. So hospitals now are actually saying, you have to have a certain BMI or you're not going to be able to have your hip replacement or knee replacement. In spine surgery, they haven't gotten to that point, but I see that happening in the future. Some of the patients I've had that we were talking about surgery have been able to put it off for a while. If they lose weight and they're able to get into a more active lifestyle, able to take better care of themselves, that some of their back pain complaints improve and they're interested in putting off surgery because they're feeling so much better. One thing you have to be aware of is if you're not in as good a shape, if you're obese, the recovery time actually will be a little bit less. It's easier to rehab. If you aren't carrying another 40 pounds, you know, when you're trying to move around, when you're trying to get up out of bed, when you're trying to do that, it takes a lot of stress off the body. And so your recovery actually will be better if you have a better BMI.
Find out more about the ITG diet. Call us now at 772-569-2330, extension 125.